In our other video, we talked about diffuse loss, such as in male pattern loss, telogen loss, anagen effluvium, things of that nature. We're going to talk today about patchy hair loss and how to make a distinction of what exactly is going on. Now, with patchy hair loss, the big distinction we want to make a division between is non-scarring hair loss and scarring hair loss, or scarring alopecias. Now, it's too broad a subject to cover all of that in one discussion, but we're going to talk principally about how to differentiate or how to make a distinction between patchy losses that are non-scarring in type. Briefly, before we introduce this, we want to make a distinction between what constitutes a scarring hair loss and a non-scarring hair loss. A scarring hair loss, and we're going to talk more about it in a separate video, really goes through and creates a look where there's no follicular ostia, there's no openings in the skin, that they're all gone because of scarring. In non-scarring alopecias or non-scarring patchy hair loss or hair loss, there's still the follicular ostia, the openings that are still there, and you can then subdivide the non-scarring hair losses into inflammatory types and non-inflammatory types. So let's start with non-inflammatory types of patchy hair loss. The classic one is alopecia areata. Now, alopecia areata can be diffuse. It can actually progress towards something called alopecia totalis, in which there's no hair on the head, or alopecia universalis, in which there's no hair also on the eyebrows, eyelashes, and the rest of the body. But we're going to talk about the classic form of alopecia areata, which are just little patchy losses. What you see in this condition is you still see the follicular ostia, but there are little patches of loss that are throughout the hair, and with this you get sometimes changes in sensation, not all the time, sometimes a little peach color, but you see these classic little what's called exclamation hairs at the periphery, which are distal breakages where the outer portion of the hair shaft is a little broader than the portion that comes right emanates from the hair scalp itself. And alopecia areata is thought to be an immune-regulated problem where the T cells are attacking their own hair. And we're not going to go through all the treatment protocols and things of that nature. That's discussed pretty thoroughly on the website. I just want to introduce how you recognize alopecia areata. There really is not necessarily an inciting factor. A lot of people think it's an emotional causative agent, but there hasn't been really a link to that. It's just really thought to be a T cell immune-regulated dysfunction. And sometimes you get nail dystrophies and other related issues with alopecia areata. But that's something that you see classically as little patches with these exclamation point hairs that are present. Another type of non-scarring, non-inflammatory hair loss would be related to trauma. For example, pressure, if you're lying too long on a bed, if you're in a coma, or if you're having a prolonged surgery without support, that can cause a pressure loss in that area. You can also have a traction of the hair loss in that area where you're getting the hair loss pulled, and that can actually lead to potentially a scarring hair loss, the traction on it. So it's a hair loss that can go from a non-scarring to a scarring type of hair loss, traction alopecia, for example, tight braids that African Americans are prone to wear. And those are sort of the classic non-scarring, non-inflammatory types of patchy hair loss. Another type would be trichotillomania, which is a psychological problem. People that have obsessive compulsive disorder, OCD, they may continue to pull the hair out, and that can lead to patchy losses throughout, usually still sparing the outer fringe of hair, and the reason being is that it's particularly more painful somehow to pull the hair that's out on the edges. And a way to investigate this is you look at the scalp, you can see abnormal breakages throughout due to the fact that the hairs are pulled out, some on telogen when they're pulled out easily, and anagen where they're sort of disrupted and pulled and they'll be frayed in different directions. That can indicate there's trichotillomania, and obviously a history of someone that may be obsessive in nature. Usually it's done when a person's lying in bed or reclining or driving or something where they're in a meditative mode and they have their hands free to engage in this activity. And a way to help with this treatment is serotonin type of like antidepressive medications can help control this behavior, as well as behavioral modification methods, which are listed on the website as well. And a way to make this distinction, whether in fact it is trichotillomania, if you're suspicious of it, you can do what's called a hair window, in which you shave in the back of the head an area of where you think there will be normal growth, and you'll see if there is normal growth in this area. And the reason being is that this is an area where the patient can't identify that there could be hair loss, or excuse me, that they can't see where it is, and so therefore they can't touch those areas, and you would see the normal growth of about 1 centimeter over a month for that condition. The types of inflammatory but non-scarring hair loss would include conditions such as tinea capitis, and tinea capitis is a infectious fungal infection that usually occurs more commonly in African American girls in an inner city due to the fact that two things predispose toward it. One is adolescents prior to pubertal changes, they're more prone to have an infection with this fungus of tinea capitis. You can look for the classic ringworm lesion somewhere on the body or on the scalp for this. Or they could have, also the African American tend to use hot combs, hot oils, and tight braiding, which can also predispose toward tinea capitis. The reason that tinea capitis subsides as one ages is that during pubescence there is a lipid layer that grows on the scalp that acts as a protective barrier against the growth of tinea capitis. And the presentation of tinea capitis is covered more in detail in the website. I'm not going to go through all the different manifestations, but there can be black dot manifestations on there. There can be a carry-on, a big boggy mass, etc. Other things that can cause some patchy hair loss, but also diffuse hair loss, are things that such as inflammatory scalp disorders that are also discussed on the website. The two classic ones are seborrheic dermatitis, which can present with a red scaly patch. Is usually more diffuse in nature, but could be patchy as well. And there's been a relationship with a fungus, Malassezia, formerly Pitiosporum, that could be one of the causative agents besides this hyperproliferation of the stratum corneum or part of the skin. The psoriasis is thought to be almost as a sort of a spectrum of it, but also a unique type of disease process, and psoriasis is also patchy, can lead to hair loss. And psoriasis is a very hyperproliferative state of the outer skin layers that can lead to a thick, scaly, silvery plaque-like area, and about 50% of presentation can be principally or only in the scalp region, and that is also covered in extent on the website. So hopefully this short video on different types of non-scarring, some inflammatory, some non-inflammatory types of patchy hair loss, but can also sometimes present as diffuse, would be helpful when you're investigating what causes could be when you're encountering patchy hair loss.